Welcome to the 2022 Global Health and Welfare Forum in Taiwan. This year, we are honored to invite a number of globally renowned leaders and experts from fields of health and well-being and welfare to provide opinions and suggestions on environmental sustainability, global cooperation, and disease prevention, and to explore how to ensure health and well-being throughout global solidarity.
We have to change the worldview. We have to require that we have to reconnect people and nature together. And maybe in many cases in terms of traditional and cultural practices. And it's more a holistic view of the world.
Global health should improve outcomes of the health, should bring the security, and should provide the strengthening of the health systems. With using appropriate policies based on the research, innovation, and clinical needs, and altogether transform to the education.
We need to look at how to stabilize healthcare systems in normal times. Many of the problems that were apparent during the pandemic were actually pre-existing, especially with shortages in the health workforce, health inequalities, and problems in coordination.
Taiwan's healthcare system was ranked as by Numbeo as the #1 in the world. And in Taiwan, we have around 480 hospitals and over 18,000 primary care clinics. So we try our best to implement good intervention and good health care for the people in Taiwan.
So during the pandemic, in year 2020, Taiwan had actually mounted an incredible response. By March of 2020, all the data were integrated. In fact, by end of January, the immigration data were linked to the National Health Insurance database, so that a doctor could be alerted at the point of care about the person's travel history if they've been outside of the country in the last 14 days.
Taiwan's National Health Command Center, coordinated response, rapid deployment of personnel and medical countermeasures, effective surveillance, risk assessment, and risk communication. These are all things that I understand the Command Center has been focusing on. These are all good things. These are all important things.
The last 3 years has seen challenges to public health and public health emergency response not previously seen in our lifetimes. These challenges have forced us to adapt to meet new threats. Though most agencies responsible for public health emergency response are domestically focused, as they should be, however, connections with partner agencies abroad is essential for success as we go forward and continue to navigate future challenges.
As a member of the global community, Taiwan is willing to share its rich experiences in healthcare and social welfare, and to work with the rest of the world.
I always was very much interested in close collaboration with Taiwan. And in the last 24 hours I'm in this country, I have even been more convinced how important it is to internationally cooperate and support Taiwan.
In the future, to ensure sustainability and the human right of health, Taiwan is willing to share its health professions and work with other countries to not only demonstrate that Taiwan can help Taiwan and Taiwan is helping, but also realize the WHO goal of universal health coverage.
And I think that Taiwan has also been a leading country as it relates to advancing health. And this is one of the reasons why at the last World Health Assembly, we stood up and supported, along with my colleague, we were able to defend Taiwan's position and the need that Taiwan needs to be around the table at the World Health Assembly.
I think Taiwan is really a shining beacon because of the way you really not only just talk, but you people have walked the talk in being there for so many countries, and we could really all take examples from you.
Thanks to help from our international partners, especially the Taiwanese government, who helped us in a number of ways. In fact, I don't think that we would have been able to do as well as we have done had it not been for the help of Taiwan.
We are working hard that Taiwan is also sitting at the table when it comes to the World Health Organization. And I'm optimistic that we are getting there. Be a little bit patient, and you have heard that for many, many years. But without Taiwan sitting at the table, we don't talk about global health. Thank you very much.